Hello, I'm Dr. Chen. Welcome to Chen Medical Channel. Most people with high blood pressure have no symptoms, and some of them may ask, why to take antihypertensive medication? In year 2014, an UK study used electronic health records from 1997 to 2010 to trace 1.25 million patients who were more than 30 years old and initially free from cardiovascular disease. During the average 5-year follow-up, more than 83,000 cardiovascular disease presentations were recorded. The results are as follows. First, in each age group, the lowest risk for cardiovascular diseases was in people with systolic blood pressure of less than 115 mmHg and diastolic blood pressure of less than 75 mmHg. Second, people with hypertension, that is, blood pressure more than or equal to 140/90 mmHg, or those receiving blood pressure lowering drugs, had a lifetime risk of overall cardiovascular disease from 30 years old of 63.3%, compared with 46.1% for those with normal blood pressure and developed cardiovascular disease 5.0 years earlier. In people with hypertension, lifetime risks of stable and unstable angina was around 10%, myocardial infarction 8%, heart failure 7.8%, and ischemic stroke 7.6%. Please note that there are certain percentage of people without hypertension still having the above events, probably due to other cardiovascular risk factors, for example, smoking, diabetes, or hyperlipidemia, etc. If you want to assess your own risk, ASCVD risk assessment is recommended. ASCVD stands for atherosclerotic cardiovascular disease. For instance, if a 50-year-old middle-aged man has blood pressure 160/95 without history of smoking, diabetes, and hyperlipidemia, after ASCVD risk estimation, he will have 4.9% calculated risk of atherosclerotic cardiovascular disease events in 10 years. Several large-scale clinical trials have demonstrated the benefits of lowering blood pressure in reducing the risk of cardiovascular disease, stroke, and other complications. To give you an idea, Sprint Research Group presented their studies of more than 9,000 patients with age more than 50, systolic blood pressure of 130 to 180 mmHg, and at high risk for cardiovascular events but without diabetes, targeting a systolic blood pressure of less than 120 mmHg as compared with less than 140 mmHg resulted in lower rates of major cardiovascular events and death from any cause. We treat hypertension because we want to prevent cardiovascular diseases, namely stroke, heart, kidney, and peripheral vascular diseases. It is important to note that there are non-pharmacological interventions and drug treatment for hypertension. Antihypertensive medication treatment plans should be tailored to individual patients based on their medical history, lifestyle factors, and other considerations. It is also recommended that individuals with hypertension discuss the benefits and risk of antihypertensive therapy with their doctors.